We are being sent from our home church as medical missionaries.
Mark Gilzon moved to Tanzania several months ago with his wife and 4 children. Mark worked for 15 years as a physician's assistant in cardiothoracic surgery. Mark has come to Tanzania as a medical missionary and is going to start up a clinic in the Rukwa Valley near Lake Tanganyika in southwestern Tanzania.
The premise is that we're sent, like in biblical times, the missionaries were sent out from their local church to spread the gospel of Jesus Christ.
The current wave of evangelical Christians from America began arriving over the last decade and are now seeking out their own converts.
So when we have our clinic open and running, yes, just because of who we are and our love for people and our love for God, we share that openly with people and say, look, I'm treating you or I'm helping you, but it's only because of what God has given me and His love for me that I'm able to do what I'm doing.
Missionaries have always been tied to Africa's colonial past, from Stanley and Livingstone through the British and German forces, which once occupied Tanzania, and the nuns and priests that came with them. Sister Elizabeth Kerp is the chief administrator of the St. Joseph's Mission Hospital in Paramio in southwestern Tanzania. She has been here 25 years. St. Joseph's began life in 1923, staffed by a handful of missionary nuns working out of clay huts. These days, the hospital is one of the most important medical centers in the region, with 400 beds and over 300 employees.
We have a gynecologist, we have a cataract surgeon, we have a dental surgeon.
They treat more than 15,000 people a year, many of them for diseases like AIDS, malaria, and tuberculosis. The stories of Mark Gilzon and Sister Elizabeth represent 2 of the major strands of missionary work in Tanzania, and in many ways for Africa as a whole. Tanzania's long-established Catholic and Lutheran hospitals are a relic of the country's colonial history. Keeping it going is a constant struggle.
Financially, we need always more help.
Tanzania is one of the poorest countries in the world. Many of its people lack basics like clean water, sufficient food, and access to medical care.
We are struggling very hard now to be able to pay the salaries. And the government has a special program employing nurses, and they are, let's say, stealing from all over the country the nurses from the faith-based hospitals.
Like their colonial forebears, missionaries in Tanzania try to spread their religion through doing good works. For medical missionaries, that means providing healthcare services where none were previously available.
Initially, we came in 2005. My family and I visited. We flew into the Rukwa Valley and visited my friend. And at that point, being from a medical background and different things, I began asking questions of where's the hospital, where's the dispensary, where's the, anything. And basically, the answer was, well, we don't have one of those.
The problems that Tanzania faces are not due to war or natural disaster, and the government is relatively stable and democratic. Tanzania's problem is poverty. 20% of children are malnourished, and in some cases nearly 40% of children have stunted growth. 1 out of 3 people will not reach the age of 40.
Yeah, malaria is still killer number 1. And of course, the big problem of HIV/AIDS.
Sometimes the hospital runs short on quinine, which is used to treat malaria.
Which is rather a serious thing. I would say it's killing people if you couldn't get them somewhere else.
I'll be going back to the States in probably 2 to 3 years, and I'll be going back with pictures of what we're trying to do, and more information as to we could really use a lot of whatever medication it is that we're dealing with. I've already talked to many of the pharmaceutical companies, and they're very willing to help support and help us.
I remember in '93 we had the meningitis epidemics, and patients were all over lying on the floor. We had to look for mattresses and so, and I traveled very much to get meningitis vaccines. It was a scary situation. Yeah, it's a big job.